freshman biology teacher that I drove crazy. She literally would pull at the roots of her hair like, Susan!
What is it that you did?
I would just ask her tons of questions because, we were dissecting things and we had to do presentations and microscope work and bench work, and I just loved it. And I really loved her. She was a great teacher, and but I think I drove her crazy.
That curiosity, those questions.
Yeah, and I learned a lot that year, and I kind of have a half of a memory that she said, you should be a doctor.
Welcome to In Contact with the ACO. I'm Dr. Chris Burritt. Each month, we feature a case presentation, interview, or discussion by one or more of our doctors who practice a different kind of psychiatry. We're interested in your questions and comments, and I would love to hear your feedback. Send an email to aco@orgonomy.org. If you're interested in attending one of our webinar presentations, you can meet the doctors and join in on the discussion afterwards. You can connect with us and learn more at adifferentkindofpsychiatry.com or orgonomy.org. This episode features an interview with Dr. Susan Marcel and how her path brought her to becoming a medical orgonomist.
Dr. Marcel, I wanted to sit down with you. I wanted to hear your story because I think it'll help listeners get to know you, the ACO, but also help them understand medical orgonomy. So in some ways the question is just simple. How did you get to be where you are today? Mm-hmm. How did you become a medical ergonomist?
Mm-hmm. Yeah, it's been a journey of many steps. I wanted to be a doctor since I was 8 years old, so never thought I'd be a psychiatrist though, so it kind of wounded my way through. I had a wonderful family doctor when I was a kid, Dr. William Stack, and he just took great care of us and my brothers and I when we were little, and he was warm, he was caring, and he just connected with you no matter what the problem was. So that left a real deep impression on me. And
that reminds me of like a Norman Rockwell painting in some way.
Oh, sure.
Just that image I'm getting.
I can see his office. I can picture it still to this day. What it smelled like, where things were,
wow.
His blood pressure cuff. He had a little black bag. The thermometer, everything, and I always felt better when I left there, variety of colds and earaches and, sore throats and stuff like that. So, and then when I was around 8 years old, I was hit by a car, which was a real shocking thing. I got a concussion. Yeah, I could have died, but, here I am. But I got really good care there, and Dr. Stack again, I just remember the warm care and concern. And, I stayed home from school, and my mom was checking on me every half hour, make sure that I was okay. But I remember around that time kind of formulating this idea, like, I want to be like that doctor, because he took good care of me. I want to be like him. So I started looking up to him in some way in my mind. So that was like the first impression of Susan wants to be a doctor. Yeah. And then I grew up in a very large Italian, Irish, Catholic family in Philly. So everybody talks, nobody listens. And I'm very much an observer. I just kind of watch, and I used to just kind of watch things, and I'm naturally very curious. So there's a lot of excitation, and I just would kind of take it all in. And but I was curious about, who are these people? How come they all, interact the way they do? So another thing I thought of was my dad was a really strong observer of other people. We used to sit on the boardwalk down at the Jersey Shore as a child, and we would watch people, and he would say to me, what do you think he does for a living? Or what do you think her name is? Or what about the way they're acting? So somehow I learned how to just be an observer, and I was naturally very curious child. So, and I spent a lot of time outdoors. You know, I love nature and the world, and I just loved being alive, loved being a kid, and also played piano too. That was a way to just kind of have my own voice in the room. You know, everybody's talking, there's all this chaos and chatter, and I would just sit at my piano, and I've been playing since I was a little kid. So that was like the early foundation. And then I remembered in fourth grade, my science teacher was kind of babbling on about the solar system. And, you know, it's later in the afternoon, and, you know, getting ready to go home. And I'm sitting there at my desk, and I was pretty tall for my age, so I was always in the back. You know, and I remember looking out the window, and the sun was coming through the window, and she's talking about the sun and the moon and this, you know, the planets in the solar system. And I remember thinking, wow, there's the sun. Like, what is that? You know, where'd that come from? And I was daydreaming, which I did a lot, and she kind of yelled at me for not paying attention. But I remember thinking, wow, that's sun, there's something there. You know, again, I was curious, even though what I was being taught was pretty rote and mechanical. So, and then I think fast forward going through to high school, I had a really great freshman biology teacher that I drove crazy. She literally would pull at the roots of her hair, like, Suzanne.
What is it that you did?
I would just ask her tons of questions, because, you know, we were dissecting things, and we had to do presentations and microscope work and bench work, and I just loved it. And I really loved her. She was a great teacher, and but I think I drove her crazy.
That curiosity, those questions.
Yeah, and I learned a lot that year, and I kind of have a half of a memory that she said, you know, you should be a doctor, and you know, and I didn't connect the dots. You know, it was still kind of seeds that were fermenting and germinating. But I was very curious. I just wanted to know. I would look in a microscope and go, what is this? You know, I remember seeing an amoeba and going, what is that? You know, I had never seen anything like that before. So again, that love of science, love of nature. And my parents told me I could be anything I wanted to be if I worked hard enough. So that was good fertilizer. You know, they really believed in me, you know, moving on and doing something, you know, that really was, you know,
something big,
a good fit. Yeah. And my parents came from nothing, you know, so for them to push their children, that was kind of what the culture, you know, in our family promoted, like, you know.
Have your children better off than...
Yes, yeah. But I think early on I began to see that there was a difference in the way things were taught. So there, you know, I had a gut reaction, like when things were taught very mechanically, it repelled me. Like, I just went, oh, you know. But if it was taught more, you know, hey, this is life, there's something amazing about what you're seeing, and hey, look at this, what do you think of that? And just observing. And that I just was drawn to, you know, to what was alive and spontaneous.
When you say that, I'm thinking of, like, you know, memorizing the planets in order from distance from the Earth versus, like, you're feeling the warmth and seeing the sun outside, and that's what you want to...
Right. So I kind of intuitively knew the difference. I didn't know that that's what I was doing, you know, consciously, but it was right. And I really loved, like, going on field trips, and I loved, you know, the lab work and hands-on. You know, I remember the first time one of my teachers lit a Bunsen burner, and I'm like, isn't that cool? You know. And I kind of found my niche in high school and college. Like, it was okay to be smart. You know, I wasn't athletic. You know, I could do things, but I wasn't going to be, you know, an ace basketball player, or, you know. So, you know, it was okay to be smart. And, you know, the idea of becoming a doctor was germinating a little bit more than through high school and college. And along the lines, I started thinking, maybe I want to be a pediatrician and work with children. Because I just think kids are great, you know, they make you laugh, and they're fun, they're spontaneous, and they're sick. You want to make them better the way, you know, my family doctor had done. So it was around this time, like in high school and early college, I lost 3 of my grandparents. They kind of died,
Oh, wow.
in succession of various illnesses. And it was, and 2 of my 3 living grandparents, they lived with us while they were sick and dying, and they had hospice care. And it was really pretty awful watching them, kind of wither away from cancer and heart disease. And that left a really deep impression on me, because I would go visit them in the hospital, and I saw the doctors, and the doctors seemed kind of cold and mechanical, and the pain management, at the time I didn't know this, but the pain management then was terrible. And they really suffered, and they didn't need to, and it hurt, like the grief of all of that. My one grandfather I was very close to, my mom's dad, and just watching him wither away, it was really awful. So that, I think, left an impression on me, like, I could do better than that, There's suffering in the world, I can make a difference, And I didn't understand what cancer was. It was just like this illness that kind of invaded your body. And I felt pretty helpless, and I kind of buried all those feelings. I had buried the feelings of the car accident when I got hit by a car, and then my grandparents passed. I remember just kind of like, okay, just tuck that away. And I didn't deal with that probably for maybe another 5-10 years. But that was a significant window of time when they all died. And it was also around this time, like that was through college, middle of college, my 4 years at college. I decided I was going to apply to medical school. That was a big choice for me, because I was a biology major in college. Loved it. I think I drove my professors crazy. I did research under one of the professors there, and I really enjoyed just having a lab to myself and just working on some things. And so I decided when I was applying to medical school that I wanted to be a pediatrician. That was the stated goal. Yeah. And during my pediatric rotation in medical school, I met a doctor who was training to be a medical orgonomist at the college, the American College of Orgonomy, and he left a really deep impression on me too. So again, all these kind of impressions I was getting kind of helped formulate where I was heading. And working with him on the pediatric unit, and the way he interacted with the kids, the families that came to visit, the staff, the attendings, he was warm and caring, and he connected, and he really had a nice way with the kids that was different than other doctors that I had been around working with and been around. And that left an impression on me too. So again, here I am, this kind of observing kind of person watching, wow, that's a great way to be. And, so I remember one day during that pediatric rotation, I pulled him aside, and I had a question. I was struggling with something personally, and I said, what do you think I should do? And he looked at me and he said, you need to be in therapy. And he was spot on. It was good advice, which I eventually did. And and then I moved on and continued through medical school, all the different rotations. And during one of my rotations, I was working in an emergency room, and there was a family that brought their 6-month-old baby in, who was having severe asthmatic attack, and this kid looked terrible. I had seen kids on different rotations, but I'd never seen anything like this. And there were 8 of us in the code team, and she was coding. She was in respiratory arrest, and then she went into cardiac arrest. And we worked on her for a while, and she died. And the attending called the code, and I remember just standing there, silent, like this little baby just died, and the parents were right outside the room. It was awful. And I remember standing there thinking, if this is what pediatrics involves, I can't do this. And there was no discussion, I had to go on to like the next patient. It was awful. And I remember thinking, I can't do peds. That's not for me. And it was pretty awful. So I decided maybe what I could do is do family medicine like Dr. Stack, my childhood doctor. And so I applied and got into a family medicine residency and did really well through that, but I was restless. I had to see a patient every 10 minutes, 15 minutes. We had, clinic, and we would rotate through doctors' offices and we would do rounds in the hospital, but it was very mechanical and pressured. And
you were restless, or
I was restless, yeah, because of the system I was in was not allowing for me to connect with patients.
I see.
It was like, okay, they come in for the sore throat, just talk about the sore throat, but they're having other problems. You can't go there. And at the time, HMOs were coming into play, and the insurance push, and the doctors were trying to make a living and keep their offices open. I was just not happy with that setup. Like I knew I was kind of built for something else, but I wasn't quite sure what. And during my family medicine residency, we had to do a block in a psychiatric unit, which to my surprise, I really enjoyed, because I could take a half hour or 45 minutes and just listen to what someone was saying and really get to know the problem. Like, what do they, yes, okay, they have depression or anxiety or psychosis, but what's going on? What's happening at their home life and their work and their families? And I was able to get more at the root of maybe what was bothering people. And to my surprise, I really liked it. And I thought, you have to be crazy to be a psychiatrist,
Yeah, you said you're surprised. What was it that was surprising?
I think I had an image of what psychiatry was. Like, you had to be nuts to be in psychiatry. In the way psychiatrists are portrayed on television or in the movies, the typical Dr. Freud, with the beard and the pipe and the couch. And I never thought that was something I would do. And yet I found that I was able to connect with patients. And I worked with this one psychiatrist I worked with. He and I, we would talk about patient care. And one time he just said to me, I really think you have a knack for this. You should think about psychiatry. And it, something in me kind of went, oh,
what?
Yeah, okay. No, I responded positively. I wasn't surprised. It was like he was saying what I knew, but I just wasn't fully conscious of and letting myself go there. And then I thought, I have to tell my folks I'm going to be a psychiatrist, maybe, because that was so not in their, wheelhouse. So, and I decided to just take that risk, and I applied. And right around this time is when I also started therapy. So during my family medicine residency, because I was restless. I was not happy with the work. Like, yeah, I want to be a doctor. I thought I wanted to be a pediatrician. Then I had to make a change from that. Went to family medicine, and I liked the people I was working with were great, but I just couldn't get at the deeper stuff, or the, what was triggering a lot of their problems. So, I just found that I said to myself, if I don't apply for a psych residency now, I knew I would regret it later. So it's like I had my midlife crisis in my late 20s. Like, if I don't do this now, because my husband and we got married, we wanted to have a family. I'm like, when am I going to get to do?
So practically speaking, it was probably the worst thing you could have done, but you felt deep down that was what you needed to do.
Yeah. And I applied to 3 programs, got into all 3. I'm like, okay, it's a sign, And so, did the interviewing and got in, and accepted a position. And I remember just showing up that first day and I felt like, okay, this is what I'm supposed to be doing. I liked the work. I mean, it was hard work. You were on call every 3rd night, and your weekends were shot usually, and but the work, I really enjoyed working with patients. We worked in the emergency room, inpatient, outpatient. We did work in state hospital, in the VA system. So I got a very good exposure to lots of different aspects of psychiatry. so that seed that was germinating all those years, it's like it finally started growing, and you know, I have no regrets looking back at that. And it was, that seed. Each person I met along the way kind of helped that grow, but even after let me go back. When I finished my residency in psychiatry, I started my own practice. I wanted to be my own practice and my own boss, and not work for someone. And I thought, all right, I'll try it. If it doesn't work, okay, then it doesn't work. But I was pregnant with my son, so I graduated, started my practice, and had my first child, all in the the first that 6-month window.
Wow.
Yeah, it was crazy. When I look back at it, I go, what was I thinking? And yet I just I knew there was a part of me. It's like just keep chipping away, and that's my personality. It's like, just come on, you got this. Come on, you can do this. Just keep sniffing around. You'll figure it out. It's like I trust my own intuition. So, I started my practice, and I was in therapy for a while, and I worked with a therapist who knew not to push me and just kind of let me just kind of explore things, but I had buried all those emotions, like the car accident and the birth or the death of that child, and then he got really sick, and what a loss that was, because we had a really good doctor-patient relationship, and I really valued that. And now I look back and I see the value of that stability that he gave me. I was just able to just vent the things. When we're doctors, we are dealing with people's suffering. That affects us as human beings. You can't just take it all in. You gotta sometimes just sit down and cry at the losses and the pain that we witness every single day. So that was a really important piece of those 4 years in my residency and when I started my practice.
The way you said that reminds me of, I think I've heard someone else say it's to maintain your sensitivity but also be able to get through the day is an enormous challenge, I think, as any kind of doctor, but a psychiatrist.
Yeah, because you can get hard. Really, I know if I had done emergency medicine, which I kind of toyed with for a while because I was pretty good at that, but you had to be really thick-skinned and tough to just see all this trauma coming in the door, and death and illness, and I'm just not built for that. And I figured that out very early on. To maintain that sensitivity is really important for all doctors, but even after my son was born and I started my practice, the next 5 to 7 years, things were just kind of chugging along, and but I was still at that restless feeling. It kept bothering me. I saw this split in psychiatry where it looked at the body and the brain as a machine, and just find the right medicine, like a lock and key kind of theory, like you use this drug for this receptor, all will be well. And yet I wasn't getting everybody well. There were people that didn't respond to that approach. And then the psychotherapy disciplines I was instructed in, was more maybe cognitive based or psychodynamic based. And so I had to magically kind of come up with something to say that might help the patient have an aha moment, and their life would be better. So there was this split that I couldn't integrate. I couldn't pull it all together. I'm like, there's got to be something else than just talking and just finding the right drug. And so I guess about 5-6 years after I started my practice, I reconnected with the doctor I had met on my pediatric rotation, who was training to be a medical orgonomist. And we had a couple of phone conversations. I found him, he had started a practice, and I was telling him what I'm telling you now, and that I was looking for something, but I didn't know what, and he sent me 2 books, The Murder of Christ and Man in the Trap.
By Reich and Baker?
Yeah, The Man in the Trap is by Dr. Ellsworth Baker, and Murder of Christ by Wilhelm Reich. And when I read them, there were parts of it that just felt like, oh, okay, that explains some things, and growing up Catholic, the story of Jesus and, what he was, who he was, I never understood how he could be murdered. He was a really deep person. He did a lot of good, and yet he died. So reading Reich's book, The Murder of Christ, and about the emotional plague, that left a really deep impression on me, that there's something out there that is really toxic to life, to people's ability to work and to love and their relationships. So that got me very curious about what was orgonomy. But by this point, I'm in my late 30s, early 40s, saying, what is this? And I had 2 little kids and a practice and a mortgage, and like, what is this?
When you first met that doctor, did you ever talk about orgonomy?
Not at all. No, I just knew he connected differently with the kids.
I see.
He had this, like, he'd be on the floor, and we had this one room on the peds ward that was filled with just toys, and he would go in there and try to examine them, but he's playing with them, and I he just got on the floor and was at their level, and was able to do the medical assessment and take care of them, but also connect with them, the way you need to connect with a 5-year-old or a 10-year-old. So reading those 2 books really got me thinking, like, okay, where do I want my medical career to go? What kind of work do I want to do with my patients? And my practice was growing. I was seeing a lot of patients and really enjoying the work, but knowing something was missing. Again, wanting that depth. And it's not just about neurotransmitters, because if that was the case, then all my patients would be magically well with the pills, and it wasn't. They were. So.
I'm thinking when you mentioned reading those books, what I remember when I first read some of Reich's books was that some of that curiosity I had was satisfied. Like, I found some answers to questions that maybe weren't even clearly thought out in my mind, but it just felt like something was answered. But it also encouraged more curiosity, because there's so much more to learn and to discover, I think.
Well, with Dr. Baker's book, Man in the Trap, I felt like someone handed me a blueprint. Here, try looking at it through this lens. And it made so much sense. I started being able to see people a little differently, saw myself differently, to understand character and how people become pushy or prickly or anxious, or how they may split, and it really got me interested in orgonomy. And I attended a couple of the conferences that the college had, and heard. I remember one conference they had on midwifery and the care of pregnant women, and I forget the exact title of it, but I remember sitting there, and it was a room full of people who were midwives and doctors, and I thought, this is pretty cool. Again, the care of children and pregnant women, which is something that I kind of intrinsically, like to do, and I think it's important to protect the health in kids. And I wanted to protect my own children's health, because I saw the world they were growing up in. And I'm like, I have to be the best mom I can be, so that they can have the best shot at a healthy childhood.
And that was your feeling in what year?
Consciously or unconsciously?
No, I'm just thinking, and you're saying, looking at the world around them, and I'm just thinking how much has changed.
It's much more toxic now. But so I decided to work with a medical orgonomist, and so I started therapy in my early 40s, and just started, again, not pushing, just looking at things and dealing with the suffering that I was experiencing in my own life, in my patients' lives, raising kids and their troubles, and then I decided from that experience, from my own work as a patient with a medical orgonomist that I wanted to study this more. And so, I took the didactic class, and the college accepted me as a member. So, it started out as a very young girl, and it ended up, where I'm still learning. And one of the things that, thinking about us having this conversation today, I remember thinking that I've always known, even as a young child, what orgonomy was. I just didn't know its name. Orgonomy is the science of man's relationship with nature. And I think through my whole life, when I look at this arc of, the story of my life, I've always had this relationship with nature, whether it's being out in the woods, or on my bike, or hiking, or looking in a lab at a microscope, or sitting with a patient, or raising my child, or looking inside myself, like in my relationships, just nature, our relationship with nature, and studying that. I've always been perceiving that and looking at that, and I just didn't know what to call it.
Yeah.
Yeah.
Wow. Yeah. I mean, that makes a lot of sense, because I think I feel similarly. Do you remember when you first heard the word orgonomy, what your impression was? I don't actually remember exactly. I'm just curious if there's something about it that seems to make sense, although I think something new, people don't always react with just.
Yeah, I don't know that I remember that consciously. It wasn't foreign. It was just, there's this discipline, there's this science out there. Again, my curiosity, I wanted to learn.
Yeah.
And also, I myself personally, I didn't want to be in as much pain as I was, because having almost died when I was a kid, and watching people suffer, like my grandparents, and listening to patients and their suffering, and then watching my own children with their struggles. I needed a place to kind of work that through and express it in a way that wasn't just talking with words.
Yeah.
It's more like, well, what's happening in my body? What's happening in my mind?
And there are some things there are no words for.
Exactly. The grief of the child dying, I can hardly put that into words sometimes when I think about it. And even telling you, it's just that moment where she died was profound. And I wasn't emotionally equipped to grieve properly. So, I teach medical students now, and we're much more aware of the emotional life of medical students, because they're getting hammered. They do a lot of work, and are they emotionally equipped and supported to handle what they witness, and the suffering that they witness, no matter what field they go into. So, but that wasn't in place when I was in medical school or in my residency. I wish it was, because but fortunately, I was able to work through and handle that grief. I cried a lot over that little girl. I wish I could remember her name too. I don't know what her name was, but that family, that their lives were changed, and I wanted to go talk to the family, but I didn't. But that was my instinct to comfort them in their grief, but I didn't. The team was just standing there, and then everybody just went about their business.
I still remember the first time I was in an emergency room. I think it was a medical student before residency.
Yeah.
But I just remember the weirdest feeling of, there was a code going on here. Yeah. And then there's like life going on as normal over here. And I just had this sense like, shouldn't we all be like how do you, I couldn't wrap my head around this feeling that like there was just partitions of things going on that I think that is just how it has to be, and not everyone can rush and do that, but just the emotional tone of it, it was hard to make sense of.
I would agree.
Can you say more about, you're a doctor and you're a patient, can you say about like I find my own therapy is essential for my practice as a psychiatrist. Can you say more about that?
Yeah, I get out of my own way. I could just kind of go, "Oh, Sue, shut up." Well, I mean, the part of me that's not healthy needs some attention, and little by little, I've been able to chip away at that, and I repressed a lot of things growing up because you just didn't talk about your emotions, your deeper stuff. You kind of pulled yourself up and, took the next step. And that's fine, but it also leaves a space that you don't get to cry when you need to cry or be angry when you need to be angry. So, and I think doctors, and I know I've suffered with this in a way, like we're supposed to have all the answers. Well, no, we don't.
Yeah.
And that's okay. And therapies helped me realize, like, okay, just to be with a person is enough. You may not have the answers.
Mm-hmm.
Just somebody there, and you're not alone. So I think I felt alone a lot when I was a kid, even though I was surrounded by all these people, and I had a good life, but I was alone, and I never really understood how deep that went until I was able to start therapy. And then because I can go there and know that in myself, patients can also probably pick that up for me. Like I'm okay with when they express that, and I get it, and they know I get it.
Yeah.
That I'm not talking over them. I'm not going to gloss over it. I'm not going to, belittle it or try to divert from it. It's like, no. I mean, we all have this place inside of us that, just to sit with somebody and be taken seriously. That's probably the difference, I think, about orgonomy. There's a way that the doctor takes you seriously, and I needed that.
Yeah. You didn't say it, but I guess that's what I felt when you were talking about even the doctor you met who introduced you to orgonomy. Is maybe that's what he was doing with the children. He was taking them seriously. They're not just little people who...
Really, it was eye contact. I watched how he would make eye contact with them. So he'd be putting the stethoscope on their chest. They'd be screaming and crying or whatever if their mother was holding them or the nurse was holding them. But he tried to make eye contact with them, and that calmed him down. It's like, no, you're all right. I got you. I got your back. I got your front.
Yeah.
You're going to get through this. I know you're sick, and I'm just here. And I think what I observe in a lot of patients is they're really uncomfortable with letting themselves be that vulnerable, to just let someone else see them and be vulnerable. And just, I know that's how I felt, and I see that a lot in many of my patients. But I have great respect for my patients. They have tremendous courage in being able to just face what they feel. So just recognizing that in them. What doctor talks about courage? Just to have courage comes from a French word for heart, cœur. Just to find your heart, even though you're scared or you're upset, just to be courageous. So, my patients really humble me sometimes, and I think, how the heck do they get through their day? And yet they do, and they do great things with their lives. They overcome. I could tell you story after story, but just, some of them shouldn't be here, and yet they are.
Yeah.
Because the life in them is just so strong and vital, and they're willing to just work at it. And that's how I am with my own therapy, is I'm just willing to, that life in me feels so vital. So.
Yeah, there's something, I don't know quite the words, but in my own therapy and training, I think it's helped me have an appreciation just for life and for people. And despite all of people's problems that we all have, you and me included, that there's so much good that's there still,
That'll never make the headlines. But it should.
Yeah. Yeah. Well, I very much appreciate you talking with me and
Sure.
sharing
My
part
pleasure.
of your story.
Yeah. I've enjoyed it.
Thank you, Dr. Marcel.
You're welcome.
I have the pleasure of calling Dr. Marcel a friend, and I know I appreciate her excitement and curiosity. I'm hoping to sit down with more of the ACO doctors, so let me know what you think of this interview and others to come. I would love to hear from you. The easiest way to get in touch is email aco@orgonomy.org. You can connect with us at orgonomy.org or adifferentkindofpsychiatry.com. If you like our work, be sure to leave a rating and review. The best way to help the ACO spread its knowledge is by letting others know about us. We have a new episode each month, so stay tuned. I'm Dr. Chris Burritt. Thank you for listening to In Contact with the ACO. Since 1968, the psychiatrists affiliated with the American College of Orgonomy have been helping patients discover greater satisfaction, health, and overall well-being in their lives, whether patients suffer with mental illness, struggle with addiction, or feel unsatisfied with their work lives or relationships. Medical orgone therapy, as practiced by the physicians at the ACO, offers a way forward, often without the use of medication.